All right, everyone, it's 8 o'clock, so we will begin our webinar today. Thank you for joining us. And this is our update from January 26, 2021. It's our third part in our COVID-19 vaccine webinar series. Today, we're going to talk about vaccine distribution updates and the vaccination of essential workers. I'm joined today by my colleague, Amy Murphy, and she's going to do sort of the heavy lifting today, talking about the vaccination of essential workers, the order that everyone's asking about. And I'm going to start today by talking a little bit about where we are on vaccine. All right, so again, today's topics, here's our agenda. We're going to talk real briefly today about the latest MDHHS order that came out on Friday that has some impact on restaurants and other sort of entertainment type venues. Then we're going to move on to our COVID-19 vaccine distribution. Where have we been? Where are we now? And where are we going? Then Amy's going to jump in and talk about the guidance from Michigan Department of Health and Human Services, the vaccination phases, including essential workers and critical infrastructure sectors. And then last, we're going to provide some resources from, for county health departments, the Meyer pharmacy partnership that we mentioned in our client alert on Friday, and a DeVos Place clinic that was just recently announced, and there'll be a webinar on that later today with Spectrum Health, Mercy Health as well, and the Kent County Health Department. As I mentioned, we're going to talk real quickly here about the order that came out on Friday. Again, that is going to be effective February 1st, and Amy, feel free to jump in if you want on this one. Again, so it talked about indoor gatherings. That's sort of the second bullet point here on the order itself, are prohibited at residential venues except when no more than 10 persons from no more than 2 households are gathered. Outdoor gatherings are permitted as follows. At residential venues, 25 or fewer persons are gathered, comprised of no more than 3 households. At non-residential venues, 25 or fewer persons are gathered at a venue without fixed seating, and attendance is limited to 20 persons per 1,000 square feet, including with any distinct area within the event space. There are other limitations as well. Again, with all of these gatherings are prohibited at entertainment facilities and recreational facilities unless things like mask requirements are met, including when eating or drinking. Social distancing must be followed, no physical contact. If you're like me and you have children who are playing some sports, my son, who is 9 years old, is playing basketball, but all they're doing is shooting drills and dribbling drills. They're not scrimmaging against each other. And again, there's 20% capacity limits, 25% limit for restaurants that are offering indoor dining. So we're opening up a little bit here. The governor, in holding the press conference, providing an update, mentioned that we have helped, there's fewer hospitalizations. The ICUs are less full than they were early, at the end of November and throughout December. So we're opening things up. So we're headed in the right direction. Just need to keep doing what we're doing here. All right. So now we'll talk about vaccines and where have we been. Again, as you'll see here, we're kind of going to go back and forth between federal and state. Really the big federal movement was Operation Warp Speed, which is something you've probably all have heard of, even if you aren't exactly sure what it is. The primary goal for Operation Warp Speed, the big headline, was to deliver 300 million vaccines by January 2021. And we're actually doing pretty well with respect to the distribution of vaccines. And again, the other aspect about Operation Warp Speed, we mostly associate it with vaccines, and that's, again, what we're focusing on today. But Operation Warp Speed was also targeted developing new PPE, new therapeutics for treating COVID-19, and other what is known as countermeasures. We'll get into more detail on what countermeasures are in some of our upcoming webinars in the next couple of days. But that's an important term because that comes from the PrEP Act, which provides federal immunity, and that immunity applies to the administration of countermeasures. So again, Operation Warp Speed, one of the important aspects was that it opened the door to fast track some of these vaccines and other treatments. And so that way they could get the necessary FDA approvals more quickly. And I'm not going to go into a lot of detail about the usual approval process, but as you can see from the slide down there, that graphic at the bottom, it starts with research and developments and concludes with phase 4, which actually occurs after the FDA has approved the vaccine or drug. And as in particular, the Pfizer and Moderna vaccines, people probably heard, oh, we're at the phase 3 trial. And so that's, again, where the vaccine is being provided to individuals. I had friends whose parents were involved in the Henry Ford vaccine, and they didn't know if they got the actual vaccine or a placebo. They actually recently did find out, but that was the process for getting those approved. And again, as people are aware at this point, that resulted in emergency use authorizations for both the Pfizer and Moderna vaccines. Now, if you guys notice those, I believe it's the Pfizer vaccine is for 18 and over, and the Moderna is for 16 and over. I'm not remember, that might be backwards, but again, so far the vaccines have not been approved for use in under the age of 16. But one thing I do want to emphasize is, although these were fast-tracked, they still must go through each phase. They must still comply with the same rules, regulations, and standards as others' vaccines and drugs. For example, you may recall 3 of the studies at different points this summer were halted after patients became ill. Actually, neither of the Pfizer nor Moderna vaccines had this happen. But again, that's actually a good sign, because certain adverse events must be reported to the FDA, and they also require studies to be put on hold. There's an investigation, and then the studies are allowed to proceed. And that happened a couple different times this summer. So I think that helps, for people, if they're encountering employees or friends or loved ones who are hesitant about the vaccine. I think that's something that helps demonstrate that, the rules were properly followed here. All right, so where are we now? Again, the Pfizer vaccine was received its EUA on December 11th, 2020, and 3 days later, trucks were seen leaving Kalamazoo. We probably all saw those on the news. Initial distributions began just 3 days later, December 14th, 2020. They were mostly to hospitals, pharmacies, and public health departments. The federal government has created a couple of programs involving pharmacies to help in the administration and distribution of these vaccines. The Federal Pharmacy Partnership for Long-Term Care Program, that's a nice mouthful, is to distribute and administer vaccines to long-term care facilities such as nursing homes. Here in Michigan, CVS and Walgreens have partnered with the state of Michigan and are working with nursing homes to distribute and administer vaccines to employees and residents. And then there's also the Federal Retail Pharmacy Partnership Program, and those of us here in Michigan, and particularly West Michigan, just found out last week, we learned about Meyer's participation in that retail program, where they're partnering with the state of Michigan to receive vaccines and administer them to individuals. They started last week with 4 stores in Wayne County. And so what that partnership and that program allows pharmacies like Meyer's to do is to directly receive shipments of the vaccine and to distribute and administer those vaccines as well. According to the CDC, more than 400 million doses or 40 million doses have been distributed to the states so far. Again, here in Michigan, the first vaccine was delivered the same day as it was elsewhere, December 14th, 2020. As of January 21st, just over 1 million doses have been delivered to the state of Michigan. Again, you'll notice this trend here. As I mentioned, most of the vaccines have been distributed to hospitals. About a little over, almost 250,000 have been delivered to the long-term care program, and another 215,000 have been delivered to local health departments. We did see some reports, Governor Whitmer, when she was announcing on Friday, talking about reports of low vaccine supply here in Michigan. And we're getting about 60,000 doses of Pfizer vaccines per week. And most of the Moderna vaccine doses are going to residents and staff of the long-term care facilities, but Governor Whitmer indicated that we're going to start seeing Moderna distributed more, not just in those long-term care facilities. So hopefully that will make additional doses available to members of the public as well. All right, so we're going to move on to vaccine administration. So there are more than 20 million doses have been administered throughout the United States. And while you'll hear, a lot of criticism regarding the process and the rate of administration, the U.S. is actually doing better than most countries. If you look at, if you compare us to some of the countries over in Europe in particular, again, you can find some of these numbers. There's lots of different places that are tracking these. Amy will get into more detail on this, as I kind of mentioned at the outset, but the CDC is in charge through the Advisory Committee on Immunization Practices, or ACIP. The CDC and ACIP are responsible for making recommendations on the prioritization of administering these vaccines. So back in December 1st, 2020, ACIP published their first recommendation, which was for priority to be given to healthcare personnel and long-term care facilities. And then December 20th, they made it updated, which included a phase 1B for 75 years and up, and phase 1C for 65 to 74-year-olds and individuals with high-risk conditions over the age of 16, along with other essential workers. Amy, again, will update on where we are in this process right now, and kind of help give some guidance as to what some of these terms mean. All right, Michigan, again, began the vaccine administration the same day it first received its first vaccines back on December 4th, 2020. And again, Michigan has administered about 642,111 doses. Again, these numbers are based on Friday. They are not updated over the weekend, and so we'll actually be a little bit ahead of that at this point. I know a family member was able to get a vaccine on Saturday, the second dose of vaccine on Saturday, actually. The state has also drafted a COVID-19 vaccination plan. It's not in its final form. It's as you can see from the title of the webpage there, it's an interim draft. It's again a very long, lengthy vaccination plan, but it closely follows the ACIP recommendations. And again, so far, the raw numbers on administration are that 385,000 have been administered by hospitals, 144,000 have been administered by local health departments, and an additional 76,000 by pharmacies, and those will be mostly in long-term care facilities at 76,000. Again, I expect we'll continue to see kind of expansion of some of these partnerships, as we teased at the beginning. Spectrum, Mercy, and Kent County Health Department have already announced or are putting together a vaccine clinic that so I think we're going to continue to see these partnerships for those, especially within the healthcare community. We've seen, the government has relaxed some regulations and has said it'll exercise some discretion when evaluating, the applicability of regulations and compliance with regulations. And so there seems to be some understanding by the government to encourage these sort of collaborations and make it a little easier to get these vaccines out quickly. All right, so where are we going? Again, as we talked about from a federal perspective, as we talked about, the government has a couple programs with the long-term care program and the retail pharmacy partnerships. As I just mentioned, I think we're going to continue to see, entities like Meyer step up and participate with the government to expand and increase where people can receive these. One of the problems with these and why it's taken a little bit longer, I think, maybe to get some of these programs up and running, is that the vaccine needs to be kept quite cold, which means you need either like a sub-zero freezer. You also, or alternatively, you need to have access to dry ice to make sure the vaccines are staying at the right temperature. You need the program in place to monitor to make sure the vaccines stay at the appropriate temperature. So again, those things take a little while for everybody to ramp up. But as the Meyer partnership demonstrates, we're seeing these private entities step up and do that. Again, where we go in, the Biden administration has announced 100 million doses in the first 100 days is their goal. We're actually not far off from that already. So the Biden administration, I was looking around yesterday, and there's some consideration by them of upping that goal to increase it to, either 150 million or maybe even 200 million doses in the first 100 days. There's also the possibility of additional executive orders. We've already seen the administration issue an executive order about mask wearing, requiring federal employees and individuals on federal land to be wearing masks. The Biden administration has mentioned that it'll consider invoking the Defense Production Act, which people might recall back in the days of PPE shortage. The Trump administration certainly discussed as well, and that would allow the government to access to additional funds and kind of ramp up the vaccine production possibly. And then the other thing is the Biden administration, as part of the stimulus package, in addition to things like checks for individuals and families, discussed some significant funding in that stimulus package for vaccine administration. That way, we can train people up. We can make sure that we have open up additional clinics and make sure that we get the vaccine out as quickly as possible. All right, next slide. And again, here in Michigan, the governor has said the goal is to vaccinate 70% of people 16 and over by the end of 2021. If Michigan could administer 50,000 per day, then we could get to that 70% number by August. Again, we're not there yet. You saw we're getting about 60,000 doses of the Pfizer vaccine a day. And so we're going to need, in order to kind of get to those numbers, and we'll have to go over the 50K to reach that August number at this point, we'll need additional vaccines here in Michigan. The administration also announced that we've accelerated to phase 1C group A. These are just super fun terms to use and talk about. But that would mean that individuals who are 65 and up are eligible to be vaccinated as well. There's other members, as you might recall, in phase 1C who would otherwise be included, but they are not currently authorized to receive the vaccine. Other states have deviated from the CDC recommendations. For instance, I saw a headline the other day that Washington, D.C. is prioritizing individuals who are overweight. So it'll be interesting to see as we move forward here in Michigan, as the administration, as we kind of learn about this vaccination process, and as the governor and her staff look at these numbers, if they deviate at all from these ACIP phases, or if we continue to just follow those pretty tightly. All right, so here's a preliminary vaccine timeline. This was, I believe, updated pretty recently, as we have not quite hit the numbers that we were hoping to see. And you can kind of see here that we really don't see overall vaccination until sort of the 16 to 64 are not covered above, won't be getting it till maybe, August, and into December is when kind of the core vaccination administration period for that last group, phase 2, will be. So Amy's going to talk about this a little bit more, but this is hopefully what we're able to see here in Michigan. And this is what MDHHS and the governor, this is kind of where they see things going at the moment. All right, one other update is you've probably heard a couple different variants out there. There's the United Kingdom variant, and unfortunately that spreads more easily. The good news is there's no indication it increases severity, no higher death rate or things like that. There are reports that it has arrived in Michigan. I know last week a woman in Washtenaw County and some people around her tested positive for that. Again, good news. Initial studies have shown Pfizer and Moderna vaccines to be effective against that variant. There's also the South African variant, which is similar to the United Kingdom in that it spreads more easily. It's been found in the United Kingdom, but not yet in Michigan. Again, initial studies just came out yesterday have shown Moderna vaccine is still effective, though slightly less so against the South African variant. Moderna also announced that it's developing a booster shot to kind of address these potential variants. One thing I also wanted to mention is, right now we're talking about Pfizer and Moderna, but there's the Johnson & Johnson vaccine out there that's in phase 3 trials. And I keep hearing that they're going to have data on those to give to the FDA and possibly get approval. AstraZeneca and a few other entities have vaccines that they're continuing to develop. So again, if those are approved, we might get to see some, we might have more doses, and we might be able to ramp up the number of shots that are administered in a given day. And again, that would help us get to sort of that 70% goal, or the 80% goal, or a 90% goal, depending on who you're talking to, and allow us to hopefully return to normal a little bit sooner.
Thanks, Tim. And before we get started, I just want to say, Tim, that I really appreciate those breakdowns of the numbers of doses delivered and administered. It's one thing to see the totals delivered to the state and actually administered, but then when you see that, in the public, in the county health department realm, which is a really relevant realm for many of our clients and listeners, that 144,000 or so of the 215 currently distributed have been administered as of last week. I think that gives us some indication that this is moving, and they are getting better and more efficient, and through private partnerships, we're going to see this hopefully start moving in, or continue to move in the right direction. I'm going to talk with you all about the guidance that we've received from the Michigan Department of Health and Human Services, and how that's really playing out in real time. The question we've been getting from some of our clients is about the guidance that MDHHS has provided, in particular as it pertains to essential workers, or that phrase we all remember from last spring, critical infrastructure workers. So let's get into the details on that. But at the outset, I'd like to have you all remember that this guidance is definitely changing. It's in flux. And as vaccine distribution and administration continues, the supply, the vaccine, where we are with supply, where we are with perhaps outbreaks and facilities or particular areas of the state that are experiencing higher numbers of vaccine or COVID-19 than others, we'll see this guidance continue to change. And the prioritization within that critical infrastructure worker designation, I think we're going to see further work to categorize workers on the spectrum of those who need the vaccine earliest and those who could wait till late summer or even later to receive it. So as you can see on this slide, we've got the vaccine timeline that MDHHS currently has published. And you can get this information from the michigan.gov COVID vaccine website. All right, everybody's probably getting tired of this timeline because it doesn't tell you enough about where your workers fit. But you can see in phase 1B and in phase 1C, there are both references to essential frontline workers and essential workers. So let's talk a little bit about those two phases. All right, phase 1B, and this is the Michigan Department of Health and Human Services guidance on its website. We don't have any trouble understanding this particular part of phase 1B, people 75 years of age or older, and those fall into the group A of phase 1B. But these frontline essential workers in critical infrastructure, that's where I think a lot of our clients are wondering, where do our workers fit in? So if you go into phase 1B group B, and I agree, Tim, it is so much fun to be referring to the vaccine phases this way. We are already seeing these group B workers eligible to receive the vaccine. And there's not that much surprise here, nor is it that difficult to figure out who fits into these categories. You've got people in the education sector, in particular, the teachers and staff in the pre-kindergarten through high school levels. And then childcare workers who have direct contact with children, first responders who did not fall into phase 1A, correction workers in prisons and jails, and then certain workers in congregate care settings, child protective services, your homeless shelters, those sorts of settings that involve a lot of direct contact with other people. So Group B of Phase 1B, these people are eligible, and we have heard of some of our clients getting vaccines for example, the employees in their child care provider setting. Here's where the rubber hits the road. Group C of Phase 1B. So the current guidance from the Michigan Department of Health and Human Services doesn't give us a great amount of detail here, but the department is anticipating that there are going to be other frontline essential workers who are really essential to the functioning of society and at a substantially higher risk of exposure because of the sort of work that they're doing and the close proximity that they have to be to the public or to their coworkers. All right, and so the guidance from the department gives a little bit of detail about which sectors they are anticipating are going to fall into this Phase 1B Group C. Food and agriculture workers, critical manufacturing, public transit, your grocery store workers, the US Postal Service workers, and certain other workers with unique skill sets, but not covered above. So people who work in mortuary services or laboratories. Now, the key thing to note here with this guidance is that the department has right below this list of certain critical infrastructure sectors that they consider to include frontline essential workers. They say that there may be a need for further sub-prioritization depending on the supply of the vaccine, and that the local health departments can consider prioritizing workers even within these sectors. I want to note that disclaimer because it gives a good reminder to our listeners, to our clients, that there is a lot of decision-making being done at the local health department level. The Michigan Department of Health and Human Services is putting out its state level guidance, but the local health departments are receiving the vaccine and administering it. And depending on supply and other factors in their jurisdictions, they may be in a position to prioritize workers because there may be, for example, an outbreak at a particular facility that requires those people to get vaccinated first or early in the process. Because as you can see, these categories, especially critical manufacturing, for example, that's going to involve a lot of different a lot of companies, a lot of workers. And so there's going to be just some discretion exercised by the local county health departments. And we're actually already seeing that playing out. All right, and then you've got Phase 1C. And so this is where clients have been asking, where do my workers fit in? Because Phase 1B, Group C, Group B and Group C involve frontline essential workers. And then you've got other essential workers who are going to fall into Phase 1C. We don't have a lot of detail from the Michigan Department of Health and Human Services yet on who those other essential workers are. We know their work has to be performed on site. And the guidance we're getting so far is that they'll probably be vaccinated later on in the phases, likely in the summer. I think that likely in the summer phrase in the guidance is one where we need to really remember that this guidance is going to continue to be in flux, and summer could push into fall or winter. What I think we can gather is that those sectors listed back in Phase 1B, Group C, are helpful to giving employers a sense of where their workers fit within the various phases: food and agriculture, critical manufacturing, US Postal Service workers, grocery stores. We are seeing some indication that they are going to be prioritized. But I think what we really the only thing that we can say with certainty right now is that the guidance will be changing, and further prioritization either by the state and its guidance or by the county health departments is going to be happening, because we see it in phase 1B, group B already, right? There are certain sectors that got the highest prioritization of the essential worker categories, those people in childcare settings, in corrections worker settings. Those sorts of categories are at the front of the line, and for good reason. The state and the local level are considering who's at risk based on not only the critical nature of their work, but how often they have to be in close proximity to other people. All right, and phase 2 is just going to cover a large swath of the population who aren't otherwise fitting into these earlier groups, aren't otherwise fitting into any essential worker category, for example. All right, and Tim talked about this, so I will just briefly hit on it here. The Advisory Committee on Immunization Practices, ACIP, is that federal advisory committee developing recommendations at the federal level for vaccine distribution. And it's just this particular FAQ answer on the MDHHS website gives a little bit of detail of how Michigan is relying on that ACIP guidance. But as Tim mentioned, the state and at the local level, there may be ways in which we deviate from that guidance too. And ACIP has explained that it is relying on that critical infrastructure worker designation to do some of the work in helping to prioritize workers based on risk and how critical the work is to the functioning of our society. All right, and Tim mentioned this earlier. If you go to the CDC website and you're interested in seeing how ACIP is putting out its information, that interim guidance from ACIP is on the website and updated as of late 2020. And you can see, we'll have a couple slides here. Next slide, please, Jeff. A couple slides here that show the ways in which Michigan Department of Health and Human Services is tracking pretty closely ACIP's guidance. So ACIP phase 1B is frontline essential workers at high risk of exposure, and the categories of workers falling into those frontline essential sectors, they're going to sound familiar to you. We've got the corrections officers and the first responders, those in childcare work, and then those other sectors that we see Michigan also focusing on for later phase 1B: food and agriculture, US Postal Service, manufacturing, grocery store workers, public transit workers. We have some questions from the audience on which definition of critical worker or essential worker is the one that's operating right now. I think you're seeing it in the guidance, you're seeing it in the ACIP guidance and the state Michigan Department of Health and Human Services guidance. It is that critical infrastructure designation that we all relied on last year in determining whether your business could be up and running during the shutdown. But the important thing to remember is that further prioritization is going on right now, and almost certainly will continue, just due to the supply of the vaccine and the importance of getting certain workers in front of the line to get them vaccinated based on their risk level. And then you've got phase 1C. This is again the ACIP, the federal guidance that Michigan Department of Health and Human Services is relying on to some degree, or being informed by at least. And again, the phase 1C, there's not a great amount of detail yet. We've just got this guidance at both the ACIP federal level and the state level that essential workers not part of phase 1A or 1B are going to fall into 1C. So I think we're going to see the guidance really start to have more detail here as vaccine administration continues to increase. All right, and we mentioned this already. It's important to emphasize that the county health departments are making a lot of the decision making on the ground, because they are the ones, for many of our employers that we work with, they're the ones you're going to be relying on to get your workers vaccinated. So this is just one example of a good website you can go to if you're in the West Michigan area. vaccinatewestmichigan.com. You'll find the links to each health department in the West Michigan community, the criteria that they are following, which largely matches the Michigan Department of Health and Human Services guidance. But again, the local county health departments can be making decisions on the ground regarding who should be prioritized, even with that criteria in place. So the advice we're giving to businesses is to call the county health department. A lot of employers are trying to understand how are they going to receive information that they can then pass on to their employees, with the goal of getting employees the information they need to be vaccinated. And the good advice that we've been giving, and many of our colleagues, Sarah Willies, Sandy Andre, who you all may know from previous webinars, they are some of our frequent webinar players. They are telling clients, give a call to the local health department. Be ready to give your local health department a little bit of detail about your business and how many workers you have who you expect will be vaccinated. Make sure you're on whatever listserv they may be using to communicate information about the vaccine to the local community. That sort of groundwork now and relationship building now will pay off as we get into those later phases of vaccination where your workers will be eligible. All right, and Tim, do you want to give a little bit more detail here on the Meyer Pharmacy partnership and that exciting news?
Yeah, sure. Go ahead, Jeff. You can move to the next slide. We mentioned both in our client alert on Friday and then, at various points, particularly through my presentation, about how Meyer is partnering with the state of Michigan. Again, that announcement came out last week. And here you can see that Meyer is announcing, to help drive vaccine engagement, they're going to be working with employers and community organizations to help, help get these vaccines administered to essential workers and other individuals who are, qualified or eligible to receive the vaccine at this point. Again, so they've already, this is kind of outside the context of working with an employer. They've already created a pretty easy registration process. I know I've already done this, and I have family members and friends who have already registered with Myers. You can do it via text message. You provide some additional information, and then when you're eligible, they'll contact you to let you know. Again, there's going to be flexible scheduling via text messaging. I had mentioned earlier that the government has made it, has exercised some discretion in these areas, and they recently came out and said that they're not going to sort of crack down if there's sort of breaches of confidentiality related to scheduling some of these things. Again, they're trying to help promote doing this quickly and avoid putting obstacles in the way of providers. Again, employers and members are going to, so they do this through text messages. Employers and members will receive a reminder text one day prior to their scheduled clinic. And again, the clinic will be a contactless process, and will utilize an electronic line system to help with capacity and ensure proper social distancing. And I suspect that, we might see some additional partnerships like this. For a lot of our employers have probably utilized various entities to help with COVID testing at their location. And again, I wouldn't be shocked if we see some of that occur with respect to vaccines as well. Toward the end of last week, I think it might have even been Friday, there's an announcement about a West Michigan vaccine clinic. Again, this is a cooperation, a partnership between Kent County Health Department, Spectrum Health, Mercy Health, and that Vaccinate West Michigan. entity that Amy just kind of plugged there. And again, they're all going to collaborate to create a vaccination clinic over at DeVos Place and 303 Monroe Avenue in Grand Rapids. It's going to be appointment only based on vaccine availability. So again, obviously this depends on distribution of the vaccine, but obviously DeVos Place is a rather large facility. And we don't need that much facility at this point, but as more vaccines become available, the clinic will be able to keep people separated more quickly. I'm anticipating there'll be a spot where you're going to be waiting in line with a big area so people can be socially distanced, another area where you'll be vaccinated, and then another area where you can kind of wait out. Some people, depending on allergies, might be required to wait up to 30 minutes after receiving the vaccine. So another sort of staging area after you've been administered the vaccine. And then there's going to be another webinar. One thing we haven't discussed here is costs related to the vaccine. And again, so these vaccines were purchased directly from the manufacturers with respect to so there's no need, if I show up or your workers show up, they're not going to have to make a copay or pay some other amount. They're not going to pay for the vaccine itself. There are charges for the administration that will be made to employer, your health group, if you have a self-administered health group, or the individual's insurance will likely be charged for some administration fee. But individual patients aren't going to be charged for the vaccine itself. Again, here's another benefits group webinar where people can receive this. One thing to keep in mind, and again, we'll kind of get into this over the next couple of days, is if you end up having, a vaccine clinic at your location, or as your employees become eligible, one thing people will have to consider is sort of phasing the vaccines, because again, sometimes there can be some reactions to those. I know I had a friend who works at a hospital who felt pretty crummy the next day or later in the day after the vaccine. I know other people have had short period of time where they felt sick a few hours. So again, that's something that employers are going to have to consider as we get closer and closer to their employees being eligible to receive the vaccine.
I just want to focus a little bit on this webinar quickly. This is a good example of where Tim and I can provide some information, but as we've indicated, the guidance is changing, and there are certain people who we can point you to who are in the know. Consider whether you may have time to register for this webinar that's coming up later in the week, January 28th, Thursday at 1:00. And as we show on the screen here, if you're able to see the PowerPoint presentation, a recording is going to be made available to all registrants. So even if you can't join for that time block, I recommend registering. It's going to have great people. Pfizer's Dr. Alejandro Cane, I'm not sure if that's how he pronounces it, but he's going to talk about Pfizer's vaccine, how it works, and information about it. But also on vaccine distribution in particular, there's going to be representatives from Spectrum Health, the Kent County Health Department, the Ottawa County Health Department, and Meyer Pharmacy. And I think that's going to be a really interesting webinar that could provide a little more insight that we can't necessarily give you in this one. Tim, unless you have anything to add, I thought I would roll through a couple of the the questions we've received from our audience and make sure we get some answers if we're able to.
The one thing I would add is that the state does have a number of resources available to employers with respect to, questions about the safety and efficacy of the vaccine and education materials. So again, as we get closer to eligibility for our clients, depending on the industry that you're in, that might be something you want to take a look at and make available, post it in break rooms, that sort of things, to start hopefully, answering questions and easing any concerns that employees might have.
That's a great point. We are getting this question quite a bit, and so I'll do what I can to answer this one. Employers want to know if employees are going to need something in hand, like a letter, explaining that they work for a particular, manufacturing facility, for example, in order to receive the vaccine. So far, we are not seeing that. At least I haven't with clients I've been talking with who are getting the vaccine. Getting their employees the vaccine in the child care worker setting, for example. That's not to say that it couldn't become a necessity later, but so far we aren't seeing that. What we are seeing is that employers whose workers fall into an eligible category are talking with their county health department and getting vaccine administration lined up for their employees. And those employees aren't needing any sort of proof when they arrive to get the vaccine. We've got a question about whether, in phase 1C, where all remaining essential workers should be vaccinated, at least according to the latest guidance from the state. Does that include financial institution workers? And I think the answer to that is, at least based on what we know, yes, so long as those workers are fitting into the financial services category or some other category within that CISA guidance. And so I'll recommend that you look back at that CISA guidance. We all knew it really well back in March, April, May of 2020 when we were identifying workers in the critical infrastructure sectors. That guidance has been updated numerous times over the course of last year, and we're on version 4.0 now of the CISA guidance. But it remains the case that certain workers in financial services are part of the essential worker or critical infrastructure worker guidance. So at least based on what we know now, yes, that seems to be the case, that a financial institution worker would be considered essential. But we will continue to see that guidance from the state evolve, and we'll see in the prioritization of particular workers, where those workers fall. We do have questions about what does it mean to be a critical manufacturing worker, and that's going to be a similar answer that based on what I just said about financial services. So if you go to the CISA guidance, you'll see the sorts of workers in manufacturing who are considered critical. I can tell you at a high level that it's a pretty broad category because so much of manufacturing supports other critical sectors, the energy sector, transportation, important supply chains, including the medical supply chains, food and agriculture, chemicals. So a lot of manufacturing, certainly not all, but lots of manufacturing that supports other critical sectors. Those workers are going to be considered part of the essential worker population. Okay, and I think those are a lot of the questions we're able to answer during this webinar. I will make a plug for not only that Advantage Benefits Group webinar later in the week, but our upcoming vaccine series webinars. We've got one tomorrow in which Rebecca Strauss and I will talk about liability issues and immunity from liability, record keeping, and HIPAA requirements, a lot of the nitty-gritty details that employers have to consider as they decide whether to mandate the vaccine or whether to have a policy of allowing, voluntary vaccination. And then later in the week, on Thursday morning, Tim's going to be focusing in on for our HR and risk management folks in the healthcare sector, what we know and what could be useful to you as you administer the vaccine. Tim, do you have anything more to add on that one?
No, I mean, for the healthcare folks on the line, I'll also address, some of those liability and immunity issues that might be unique to them, especially, for instance, the PrEP Act, and also some of those HIPAA. There's obviously issues when you're both the employer and the healthcare provider. So hopefully answer some of those questions as well.
think that's everything for this webinar this morning. It's been a real pleasure to speak with you this morning and give you the information we have and our predictions for what's to come as we all sort of watch this play out and hopefully work toward vaccination of our employees in all of these sectors that really are important for the functioning of Michigan's economy.
All right, thank you, everybody.